We're discussing special nutritional diseases and management. At the end of the lecture, you should be able to identify diseases that are referred to as nutrition-related diseases. You should recognize general nutritional strategies that are employed in prevention and management of such diseases. Know the specific food items helpful in the management of such diseases. So can somebody remind us of the definition of nutrition? This is the last lecture. So I suppose by now, you should be able to say something about nutrition. What do you understand by nutrition? If nobody is speaking, then that means the class governor must speak. Can you hear me? If someone can hear me, please indicate.
I can hear you, my voice quite low.
But did you hear my question?
No, ma.
What is nutrition? That's the question.
Okay, let me give it a try. Nutrition is the scientific study of the chemicals found in food that helps in nourishment, body growth, and that helps in the general well-being of an individual.
You see, the way you have described it shows that you have. Okay. Yeah.
Sorry, I didn't get you.
I said thank you for speaking up. Yeah, and it shows that you are willing to contribute and try your best. But it also shows that in this class, you probably haven't read your notes, all of you. And this is your time now to be encouraged. But in the next 4 weeks, it won't be a good thing at all if doctors fail nutrition. Okay? So I'm pleading with you again to revise your notes. Go and revise your notes and make sure you are not assuming. I think people fail nutrition because they just assume that, oh, there's no big deal. I better read epidemiology and statistics. So please get it straight. So it's good you started by saying the science of, that's a good way. But just note that it has to do with the process, as a study of the process that food goes through and how it affects health. That's nutrition. So that process of ingestion, the digestion, absorption of the nutrients, assimilation, then utilization of nutrients to affect health. So you need to complete it like that. That's what is referred to as nutrition. So what I want to bring out of this definition is that food affects health. Food affects health. That's the aspect we want to emphasize today. That you should be conscious of the fact that whatever you put in your mouth, whatever you eat affects health. On the other hand, when we refer to food and diet, they're not the same as nutrition. Nutrition is the process through which that food goes through in the body of an animal um, or a human. But food is what you buy in the market. So when you go to the market and you buy rice, beans, yeah, that's food. And I taught you in this class that there are different food groups. Please revise your notes. The way you combine the food is what we refer to as diet. What do you eat often? Morning, afternoon, night, that is diet. The combination of food eating habitually. It's good to know that nutrition is critical at all stages of life, including adulthood. We are all doctors on this Zoom call, and we know that the different programs by different funders for children, for pregnant women, women of the reproductive age generally. But there's hardly any program for adults. Meanwhile, nutrition is critical in adulthood. If attention is not paid to nutrition in adulthood, then it's very easy to develop certain diseases or manifest certain diseases. To promote health, prevent and control diseases in adulthood. So we have learned that many diseases result from unhealthy diet, and that's informs us that diet can also be employed in their management. So if something causes a disease, if you remove that thing, then you reduce the chance of the disease. So that's what we're here for today. Now, talking about the risk factors for higher prevalence of nutrition-related diseases. If you say diet affects, what aspect of the diet actually causes problems? So remember, diet stems from food. So when you discuss diet, you must discuss each food group. I told you during the last lecture that anytime you want to discuss diet, please ensure that you pick each food group. Many people fail because of this, and that's why I'm emphasizing it again. When you are discussing diets, don't just pick the one that comes to your head alone and think, oh, okay, dietary prevention of hypertension, or people should reduce salt, and then you keep quiet, or you stop writing. You knew that before this class, you knew that before MPH. Therefore, you should know more than that. After MPH, this program should add to you. And one of the things I want to imprint on your heart is that anytime you discuss diet, mention all the food groups. That is diet. Now let's start with facts based on this slide. I would even prepare. Okay. So if we start with facts, when we're discussing nutritional related disease, one major culprit is fat. Increased consumption of fat, especially saturated fat obtained in animal foods, is a major cause of such diseases that are referred to as nutritional related. By the way, can someone tell us examples of these examples of nutritional related? Can you hear me?
Sorry, ma, we didn't hear you, ma. We didn't hear the question, ma.
We didn't hear the question, ma.
Examples of nutritional related diseases.
Okay,
I heard
protein, energy, malnutrition. obesity,
Iron deficiency anemia.
hypertension, diabetes.
Okay.
Diabetes.
Very good. Okay.
Kwashiorkor.
Thank you. So we're concentrating on adults. So these are the special nutrition related obesity. Cancer is also one. So since you are conscious of the disease now, I'm sure these factors will be ready. Increased consumption of fat, especially saturated fat, increased consumption of carbonated soft drinks. What is the carbonated soft drink that causes problem? That's a question. What is it about? What's the problem with carbonated soft drinks? Are you thinking
Sugar. It has lots of sugar.
a lot of sugar? Okay, so as much as 7 cubes in one.
Some have caffeine.
Some have caffeine. Thank you, which is not good for the heart in large quantities. More acid. They all have acid, and this acid programs the body for diseases. So when the acid goes into the body, sulfuric acid, phosphoric acid, the acid makes the body acidic, and when the body is acidic, what happens? It's a good breeding ground for cancer, for diabetes, and other diseases. Decreased consumption of legumes, raw meat, fresh fruits, and vegetables. Those are natural foods that contains a lot of antioxidants. So when people don't eat enough of such natural foods, they are deprived of the advantages, functions of the antioxidants. Of course, we all know that legumes and nuts also contain significant amount of protein, and this protein can be safer than the animal protein that always travels along with fat. Another problem is people who try to reduce their food and eat too little, maybe because they want to lose weight or for whatever reason, they eat too little or they eat fast food. This causes insulin resistance, and that can lead to diabetes. When, of course, there are many others. I think we should also include increased consumption of processed grains. Increased consumption of processed grains. So can somebody say why that is not good enough? Why is increased consumption of processed grains not, why is it a problem? How can it lead to those diseases we mentioned earlier?
I think over processing can remove some of the nutrients, like vitamins, minerals.
The first one you should mention is
But it's the preservative they use on them.
very good. Then it removes fiber. That's the
reduction in the amount of fiber.
Thank you. So the fiber is removed, and in the process, some minerals and vitamins are removed along with the fiber. So increased consumption of processed food. For the purpose of exams or discussion, I like you to start this review of these factors from fruits and vegetables. I prefer that you think like that. And that's the way that that book, Healthy Diets and Weight Control, that's the way it's arranged for simple memorization. Is it simple learning? Yeah, for you to learn it and to be able to remember it. So if we start from fruits, vegetables, then we move on to grains. legumes. Yeah. Decreased consumption of fresh fruits and vegetables. Increased consumption of processed grains. Increased consumption. Okay, let me, before I arranged it to fit to talk about increase first, then decrease, but at this moment, the way you are responding to me in this class, I need to make it simpler. Okay, so because when you are discussing food, I like you to discuss it starting from fruits, vegetables, roots and tubers. What's the next one? Grains, then legumes, before you now move to animal foods that provide fat. So if you always discuss like that, then you tend to remember. So can somebody?
Sorry, Ma, I don't know if I heard you talk about meat and dairy products.
Thank you. So dairy products, then meat. Dairy products will come before the meat. That's all the animal foods will be under meat. Thank you. I like that. So because I'm trying to reason and I'm happy that you are reasoning along. So if you approach it that way, my first approach was talking about the ones that are increased, then the ones that are decreased. But now let's approach it from each food group angle. So we have decreased consumption of fresh fruits and vegetables, increase, decrease, even the roots and tubers are decreased. These people don't like yam, they prefer to eat rice all the time. Am I right? Increased consumption of processed grains, increased consumption of legumes, decreased consumption of legumes and nuts. So what do we say about dairy? Is it decreased or is it increasing?
People like dairy, but because of financial constraints,
Okay.
a lot of people can't take it as much as they would have loved to take it.
Okay, so all full cream, well, we call it all milk or all dairy or low fat. We also call it full cream. Full cream dairy compared to low fat. So there's increased consumption of full cream compared to low fat. Is that correct? Is that the real thing that is happening?
Yes, ma. Full cream, they are less expensive.
Okay, thank you. So, and all of this was included in the next bullet before, but I'm just trying to break everything down further. So when you say increased consumption of fats, in that you already have full cream. That's the problem. That's the risk factor. Full cream is inside that increased consumption of fat. Meat, whether beef or turkey or whatever, is already inside that increased consumption of fat. Okay. Then now move on to the ones that are not food per se, like carbonated solvents. And all of these habits are combined with a decline in energy expenditure. These dietary and lifestyle changes are implicated in the growing epidemic of chronic diseases that is afflicting both developed and developing countries. So always remember that these diseases are not just in the Western world, they are here with us, but we can do a lot to prevent them.
Sorry, ma. I have a question, ma.
Go ahead.
Okay, please, ma. Is the risk factor for nutritional related diseases. Can we make them when, let me say, for example, if we're asking a question that has to do with stating stating the risk factors for nutritional related illnesses. So, for example, if we say fruits and vegetables, can we also say even with increase in this thing? Well, what about inadequate consumption? Can they lead to things like no immunity and then all these other related diseases that lack of or deficiencies of these minerals can cause?
Can you frame
Yeah.
the question in one sentence now?
Okay, ma. I mean, when we are answering questions based on if the question is risk factors for nutritional related diseases, I'm asking, ma, can even when we are saying increased consumption of this, can we also say inadequate consumption of fruits and vegetables because they will lead to all those diseases that
But
are
are you looking
associated
at
with
your screen at all? Because that's the number 1 point on the slide.
Okay.
Or am I getting your question, or are you saying we should change decrease to inadequate? Maybe if we change it to inadequate, you will know that it's the same point that is there.
No, ma.
I'm changing it to. Okay. So can you look at the first bullet on the slide? Has the person left the class or you are still there?
I'm here, ma.
So have you seen the first? Is it Dr. Ngohiri that asked the question?
Yes, ma, I'm the one.
Okay, so can you does the first bullet answer your question? On the
Yes,
slide.
ma. What I mean is that can we, like in our, let me say, example case, can we start with maybe those that increase and that's kind of categorizing it, and those that cause maybe an increase or a decrease, it will cause some illnesses. That's what I was trying to.
Well, I'm not sure if anybody understands your question. Maybe the person can reiterate it or re-echo it. But
Okay, ma, she's trying to say that can we draw a table for those that increase, all the nutritional
and the ones that now decrease, okay,
increase,
that was,
and the ones that decrease.
okay, good. I said that was, if I don't know if anybody remembers that was the way this slide was before. Did anybody notice that I adjusted this slide?
Yes, I noticed you were adjusting it as we were talking.
Very good.
Right now.
That was the way the slide was before. The ones that are increased, the ones that are inadequate, or the ones that are decreasing. So I now realize that the questions I was asking you generally, you were not answering me fast. So I felt it's good to arrange them in a way that you can link it with something you learned before, and that would help you to remember. So if you look at this slide, which I have brought before the risk factor slide, what do you notice on this current slide?
You started with water, ma.
Okay, very good. So what you notice on this current slide is that it contains the different food groups. And you see roots and vegetables, roots and tubers, grain, legumes. So what I try to now do is to arrange the risk factors to follow this pattern, so that you'll be able to remember and you will not leave out any of it. Are you okay now with that explanation?
Ma, I have a question.
What's the question?
Okay, so ma, when we're talking of food groups, it's not a separate food group.
Yes, it is. It is. But
So when
sometimes
ask any question and we want to talk about food groups,
we'll
bring it in this order.
Yes.
Water, fruit.
Yes. Always follow this.
Okay. Okay. Thank you, ma.
When you follow this order, you tend to remember everything. For example, if you have decided that, well, of course, water is not food, but you just put it there just for the purpose of remembering. The reason why I always put it first is so that you remember that before you even start eating at all, you should take water. So if in your mind, you've already known that there are 6 food groups, for example, and you are discussing or you are answering the question, and you only mention 4 points, then you know that you have not finished. So usually we classify legumes and nuts together, but the truth is that they belong to their own class by themselves. But for the purpose of answering question or whatever, meat groups generally is contains fish. Fish is still part of meat group. But you see, the way you describe something depends on what you are discussing at such a time. So if you are discussing the fact that they cause problems, which is the purpose of this lecture, the ones that cause problem and the ones that don't cause problem, then you may not want to categorize fish together with meat. Fish is good, meat is not good. So if I put them together as a group here, some people may not remember. This explanation and this time I'm taking to talk more on this is because of my experience while marking. Otherwise, this lecture shouldn't take more than 40 minutes. On my experience while marking, I'm too surprised how doctors answer questions. It's embarrassing. So for the purpose of this lecture now, fish does not cause any problem to anybody. People are not even eating enough fish. So I will separate it and make it stand separate, stand alone. But meat is a problem because of the fats. But the oil that is in fish is welcome, it's good. It contains substances that are good, omega-3 fatty acids, omega-6 fatty acids. They are good for health. But the saturated fat in meat is not good. But when you are talking about food group, fish is still under meat group. So, and then when you talk about sweeteners, condiment beverages, they are not food groups, really. They are not. It's just that we need to talk about them. So usually we talk about 6 food groups. 6 food groups. And meat is the number 6. So while egg and fish belong to the meat group. So I'll just do like this and separate so that we can discuss. If you are discussing, then we just discuss them separately. So unhealthy diets will cause different health challenges, and I brought the challenges earlier for you to be able to appreciate them. And apart from those diseases I mentioned earlier, it's good to know that they cause premature aging. And that's why such diseases are showing up earlier now in younger people compared to the olden days. So we can move faster now since we have discussed the foundation and it's clear. So there are general rules for prevention and management of nutrition-related diseases. These general rules are applicable to almost all the diseases. The first one is to take adequate water, more than 3 liters in a day. That alone will help obesity, not because it will reduce weight, but because it can prevent unnecessary consumption of food. That alone will also aid metabolism and prevent development of diabetes, not because it's going to affect it functionally, but it will help food to digest well, and the body will function well. Your body will be able to burn unnecessary fat, and that's helpful. It's also very important for the kidney because it will remove waste smoothly and to avoid blockage, to avoid kidney stones and other problems. So water is one method that fits all. Adequate fruits and vegetables. We've said a lot about this. Sources of antioxidant, phytochemicals, sources of fiber, sources of vitamins, minerals, name them. They're very good for several things. Make the body to be active early. If you take fruits in the morning, your body will be active at the time. The ones that concern this scripture, the fiber is important for prevention of diabetes, of prevention of obesity. Antioxidants and phytochemicals are important for prevention of hypertension, cancer, all of them, all the diseases. So the rule about fruits and vegetables is to consume 5 servings, at least 5 servings, and the interpretation is not more than 2 portions, 2 servings of fruits, but at least 3 of vegetables. Moderate amounts of roots and sugars, then whole grains and legumes, rather than processed grains. So when I say legumes here now, it will include nuts, skimmed milk instead of full cream, few eggs, not more than 2 in a day, fish rather than meat, and boiled. It should be boiled, not fried. Plant-based oil rather than animal fat. If you quick with plant-based oil. For those who cannot afford olive oil or avocado, to use very little palm oil or coconut oil to avoid too much condiments, to avoid alcohol, and to avoid unlimited refined sugar. So I want to select some of those diseases and discuss them. Obesity, diabetes, hypertension, hypercholesterol, gout, renal failure, and cancer. Let's start with obesity. Remember that we discussed the general prevention, the general rules or guidelines. Now we want to say the ones that are specific to each disease or each condition. For obesity, remember our definition. We don't wait until BMI is above 30 before we diagnose obesity. BMI above 24.9 associated with a health challenge is obesity. As long as it's excess body fat as beyond 24.9, there is a health condition. For the purpose of management, don't wait until there's a health challenge. So when BMI is above 24.9, then you begin to look at nutritional management. I hope that is clear. So remember that obesity is a result of combination of gene, diet, and inadequate physical activity. So when you know the cause of the thing, then you know how to deal with it. So that means dealing with obesity will require diet and physical activities. For the purpose of this lecture, we want to look at what exactly about that, what should we do. So if I ask you now, based on the explanation I gave earlier, can somebody say the things that are supposed to be done to reduce obesity? Or the dietary management of obesity based on the earlier explanation given today? Dr. Babalola, if I mention your name and you don't talk, that means you are drinking coffee or you are not in this class. You are just, your name is just appearing on the Zoom call. Dr. Babalola is not in this class, so in the attendance is absent. Doctor, hello. Hello. Don't disturb us, please. Just mute. We know you are not here. Dr. Odukoya. Dr. Odukoya is not in this class. Dr. Faleye.
Good morning, ma.
Good morning, sir.
Yes, if I get a question, the causes of obesity, right?
Dietary management of obesity.
Because the network was okay. The dietary management of obesity. Okay. Well, having the okay. Let me give it a try. Knowing the fact that the underlying risk factor for obesity involves the gene, poor diet, as well as sedentary lifestyle, or what you call physical inactivity. So we can approach it that way. Well, with respect to the first risk factor, that is the genetic
so you see, if I'm to mark you now,
we might not be able to
already failed this question because the question says dietary management. The question did not say
okay.
obesity.
Sorry, I got it wrong.
And because we are not listening, you are not in the class.
No, because I'm listening. The network has been fluctuating, so that's the problem. The network has been fluctuating.
You are wasting our time, sir.
So dietary management of obesity. Well, I have to go by the different food groups. In terms of fat consumption. Or okay, let's start this way. We said we should start with fruits and vegetables. Considering fruit and vegetables, a lot of fruits and vegetables would be an antidote, to tackling obesity. So we encourage our clients or patients to consume a lot of fruits and vegetables. So that would be a very good way of tackling obesity. Of course, we encourage them to reduce the intake of processed food, which will definitely tend towards or tilt towards obesity. Then they can, high calorie diet again. High calorie diet. They should try to reduce the amount of high calorie diet. Then talking about fats, they should limit the amount of saturated fat, which is basically gotten from the animal source. So they should plant-based oil. That would be another way of tackling obesity.
Fale, thank you. So can somebody add to it? So is it okay to say they should eat a lot of fruit and vegetables? Is that the way to say it? Anybody who wants to modify that?
Yes, ma'am.
Go ahead.
Okay, good morning, ma'am. So just to modify what he said, we just tell them to take the appropriate portion, not like too much, appropriate portion of fruits and vegetables.
What
So
is
for each
appropriate,
meal,
Dr. Dukoya?
okay, I was going to say for each meal, you're expected to take, like, if you divide your plates into 4,
Did I
half
teach
of
you
your
anything about dividing plates into 4? Anybody who knows the answer, please.
into okay, the serving. Sorry,
I don't know the
the
plate you are dividing. If your plate is a big bowl, how do I know the portion there? Please, who knows the answer?
I think 3 servings of fruits.
3 servings
2
of food.
servings
Is
of
that what I taught you?
it's
I
2.
think
2.
is it
Thank
2
you.
servings? I think it's 2 servings.
You are
2
still
servings.
thinking, doctor, because you don't read your notes. Some of you come for this MPH and you are just staying with the knowledge you had before you came. I don't think that's good enough. So that means we are wasting our time, right? Can I continue? Yeah. So obesity, you've said it's, you start from fruits, vegetables, and you should know how to explain each bullet on the slide. What about hypertension? Who is going to speak on that? How can we prevent and manage hypertension? Dietary management of hypertension.
Yeah. So
Dietary management of hypertension.
can I give it a try, ma'am?
Aguna. Dr. Faleye, you have tried. Agulana.
Yes, ma'am. Yeah.
Go ahead and teach us.
Okay, dietary management of hypertension. Okay. So we should start with fruits and vegetables. So our advice
if you don't discuss water, at least you will lose 20% of the mark.
okay, water. Okay, we should start with water. So take at least, I'll tell the patient to take at least 3 liters of water a day.
Okay.
Then at least 2 servings of fruits.
Is it at least? You will kill your patient fast.
Hello, ma.
I say if you say at least 2 servings of fruits, you will kill your
patient.
Mm-hmm. Go ahead. Somebody will help you modify what you are saying.
Okay. 2 servings of fruits, moderate roots and tubers.
Is it at least or at most?
Reduce.
That 2 servings of fruits, is it at least or at most?
At most.
Okay.
At most.
At most. At
Okay.
most 2 servings of fruits.
Okay.
Then moderate roots and tubers. Reduce, if possible, or stop processed grains and foods.
What is
legumes,
WHO recommendation for grains? Anybody who knows?
I don't know, ma'am.
Okay. Anybody who knows? I've taught you, but you people are not reading your notes, or you don't even jot when you are. It's only the PowerPoint. Those of you that don't come to class. That's why I don't struggle with attendance. Because if you don't come to my class, you can't get my points. You can't see. PowerPoint is not going to say every explanation. Please, who has been coming to class and reading notes? What's WHO recommendation for grains? I said it during the last one. WHO recommends that 50% of grains should be taken as whole grains.
Okay, ma'am.
Most of you were carried away by other extraneous things on that day. These are the 4 things. Continue, please. So
okay, so legumes and
jump to grains now. So when somebody is going to modify, the person should be noting the things to
Be
modify.
taken and reduce reduction of processed grains. Okay, then legumes and proteins, at least 0.8 gram per day servings of proteins and legumes. The nuts are very good. I don't know the recommended dietary, but nuts, I know they should take nuts. Then they should take skimmed milk and skimmed milk products. They should take more of fish than meats, because fish has omega-3 and 6, like that is protective to the heart. So they should take at least three eggs per week. For food, there's no added salts, and reduce even the salts for cooking. No, they should remove sweeteners and condiments. They should reduce condiments and moderate beverage.
Okay, so who is going to
Over, ma. Thank you.
so who is going to modify what she has said? Because she has killed some of our patients with high cholesterol. Who is going to modify it? Dr. Agulana, get a friend, though.
Okay, ma. So, friend for what, ma?
To help you modify what you have said, so that your patient will not die of heart.
Okay, Dr. Woyi will modify it for me. Dr. Woyi.
Or else your patient will die of heart disease now.
Okay. I think the egg. She said know the
I said
but I heard her
the
say
egg.
egg.
I
Say
said
it
if they have
again.
to
Don't let
eat egg,
everybody hear
3
what you
eggs
say.
per week. Okay, oh, sorry. Oh.
At most, it's supposed to be at most. So they should not pass it. At most 3 eggs per week.
Thank you. God bless you. It's actually at most 2 to 3 in a week. Boiled, not fried. And she said
yes,
our own patient should be eating at least 3 eggs every week. So that patient will soon develop hypertension.
Okay, sorry, ma. That means it's English problem. That was my problem. Okay. Sorry, ma.
Any other person wants to modify more? There are other things she said. Okay, let me just go ahead because you have.
Then I think she should. I think
who is speaking?
Meal. The process. Yes, ma.
Okay.
They should avoid as much as possible. They should avoid, not reduction. They should avoid it.
Avoid
all the
what?
process.
Okay, thank you very much. So they should avoid processed foods.
I had her say reduce. Okay. So she should tell them to avoid it. Yes. Yes,
okay,
ma.
So and the reason.
Yes, ma.
To avoid processed food. So now all these things we are saying.
And then,
you
ma,
say
I want to ask a question.
You've not even answered. You're asking. Wait now. Write your question. Write it down. Class governor. So please let's get it.
Okay.
Right. It's not enough for you to just repeat what you have said under obesity. It's not enough to say the generic prevention and management. You see that the style of this lecture is different because this is the practical part of all the other things you have learned. You are seeing a patient who has hypertension, then all the things you've learned in nutrition should come to your head. It's not theory. This patient has hypertension. What are we going to do? Or hypertension runs in this person's family and you want to prevent it. You know that in hypertension, sodium is high and potassium is low. So what is causing hypertension is not just high amount of sodium, but also low amount of potassium. Please write it down. That the problem with hypertension is the balance. between potassium and sodium. It's not just the sodium. It's that balance between potassium and sodium is the problem. So that means our approach, we must increase potassium and reduce sodium. So if you have those two in your mind, you will be able to answer the question well. So we have sorted out what she said about fruit. Fruit is at most 2 portions of fruit. Then vegetable is at least 3 servings. Then roots and tubers is encouraged because root and tuber contain potassium, but doesn't mean that the person should eat more than 4 servings because there will be too much carbohydrates consumed if the person is eating too much of it. But they should not run away from it because that patient will get potassium from sweet potato, from banana, plantain, from cassava, yam. There's potassium in all roots and tubers. Then she said, okay, so all grains rather than processed grains. All processed foods generally contain a lot of sodium. That's why they are not encouraged, right? Then the processed cereals is not encouraged, not just because of sodium now, but there is reduced fiber. And fiber is important to manage obesity. But most people that have hypertension may also have obesity. And as we reduce the obesity, the blood pressure would also reduce. So that means all the things that are important under the management of obesity, if you are discussing hypertension, you should mention them. Anything that will help the patient to lose unnecessary weight is very important, like fiber, consumption of fiber. So Dr. that spoke last said you should give 0.8 grams of protein per day. That's not what I taught you. I don't know where she got down. So there's nothing like at least 0.8 grams per day. The recommendation for protein for all adults is 0.8 grams per kg of protein per day. Per kg per day. And it's the protein, it's not the food that gives the protein. That's why I always tell you, don't make the mistake of calling food nutrients. So if you are calling chicken, for example, you call chicken protein, you've forgotten that there is fat inside that chicken and you are calling it protein. Then you now want to measure 0.8 grams per kg of chicken. Let's say the person is a 60 kg, then 0.8 grams will give you like 48 grams. So you now want the person to eat, I mean, is it 48 grams now? 48. Somebody should help me. If a woman weighs 60 kg and you want to give 0.8 grams of protein, that means 48 kilograms, right? Of protein a day. Or is it 48 grams?
It's 48.
Is it gram or kilogram now?
It's gram.
Okay, thank you. So if the person is going to consume 48 grams of protein, it's not the same as 48 grams of chicken. That's my emphasis at this point, so that we get it right. Is the protein that we are measuring 0.8 grams per kg, not the food that is supplying the protein. So you have to be careful what you say and what you write, because it shows your level of understanding, and that's what we mark. if you give me what is on this slide, you can't score more than, I'm not sure you score 50% because what is on this slide is just PowerPoint. It's not the explanation, it's not the understanding. So that's why you must understand. And if possible, you can jot and add to your notes. Yeah. So the doctor said they should take steamed milk. Is it compulsory to take steamed milk? Is that the recommendation? Somebody should please answer. Is milk compulsory? Nobody is speaking. Okay. Milk is not compulsory. It's not compulsory to take processed milk. Okay. What is important inside milk is calcium. And if you can get the calcium from other food products, milk is not the same as fish. The way we say you should eat fish, there's no recommendation that you must drink milk by force. So that's the explanation I have. For people that want to avoid hypertension, it's good to avoid tobacco, caffeine, alcohol, good to manage stress and lose weight. It's important to know that practicing these things, as simple as they are, can lower blood pressure as much as continuing blood pressure. We are doctors and we are very quick to prescribe drugs and all of that. That's why you are learning this. So can somebody try to answer for diabetes now? Or you should just wrap up the lecture fast so that you prepare for your next lecture. So when you're answering for each of them, note what is peculiar to them, what is peculiar to each condition. That will help you not just to mention the generic approach to management of all diet-related diseases. You'll be able to say what is peculiar. So can somebody answer for diabetes, dietary prevention or management of diabetes? Nobody? Okay. Dr. Ahmed, are you in
Can I
this
give it a
class?
try, man?
Or you are drinking coffee? Ahmed Gabriel Uba.
Class one.
Can you answer dietary prevention of diabetes? Please remember to remove Dr. Ahmed from the attendance, so he's not in this class. Dr. Akpeno.
Yes, ma'am. Good morning, ma'am.
Good morning, sir.
Hello?
We can hear you. You are the one that is not in the class.
Ma'am, I can hear you, ma'am. The network is actually fluctuating. I can
Answer
hear
the
some sentences.
question now. If the network is fluctuating, write it in the chat room. How can you prevent dietary?
Okay.
What's the dietary management of diabetes?
So the dietary approach of diabetes. Okay. Want to ensure adequate water at about 3 liters per day. Want to cut out processed food from the diet or reduce it to the minimum. So the barest minimum. Want to reduce sugar intake to less than 50 grams. Want to increase protein intake. Want to reduce consumption of. Sorry, want to increase consumption of vegetables and fruits, especially fruits are high in water content. We want to reduce we want to reduce consumption of fat and oil. I don't know
Okay,
the
you can
actual.
stop.
I
You
don't know
can
the.
stop. You see, you've given yourself away and you've shown that you have not been in the class. But I will encourage you, watch the video later. It's up to you. If I were to mark what you are talking now, you can't score 50%. So this is what I want to show you, because when you see people fail, they fail themselves. No lecturer failed them. These things are simple. We've been discussing them. So if you have been in this class, you should have been able to. Is anybody ready to answer? Dietary management of diabetes based on the guideline I've given you earlier. Okay, Dr. Ahmed, are you still there? Or you have left? Dr. Ahmed, are you still in the class? Okay.
Yes,
Anybody? Yeah. So what I'm saying is that if you follow the guideline given earlier, can you bring out the ones you want to modify, or you want to call a friend to assist you? Call a friend to assist you, please.
Okay, DK Nama.
Okay, so you are his friend. Go ahead.
Is my Ogama.
Is your guy? Okay, Oga Ahmed, we have a good person that wants to assist you. Go ahead, following the guidelines. I don't want anybody in this class to fail nutrition. And I'm very, very serious. It's embarrassing if our colleagues will fail our course. Okay? So Ekena, go ahead, sir.
Mama, good morning, ma. My network has been terrible, actually.
Okay, so you two, you
So
have not been in the class.
let me attempt.
Okay.
So, first of all, for patients with diabetes, there's insulin resistance and poor management or poor handling of glucose metabolically. By that, glucose metabolism in the body. So, but to approach the question generally, I will start with water.
Okay.
So I would encourage the patient to take at least 3 liters of water. We are in the tropical region also. Water is very important because it helps patients to lose weight, not just because of the function, but because it allows the body to burn unnecessary fats. It helps to balance the pH also, and ensures that normal metabolic processes go on as they should. Then next, I would encourage patients to take fruits and vegetables. Fruits and vegetables, okay, fruits first of all. Fruits are usually rich in potassium, which also helps in the metabolism of glucose, and also contains fiber, phytochemicals, antioxidants are also necessary for normal metabolic processes and helps the body to remain healthy. And I would encourage patients to take, the recommendation would be to take 2 servings, as at most 2 servings of fruits and vegetables in the diet. Then I would encourage patients to take moderate amounts of roots and tubers. That would provide calcium, which it will provide potassium rather. Roots and tubers are very important sources of potassium, and like I said earlier, it also helps the metabolism. And I think that for the roots and tubers, I would ask, because this is actually diabetes now, so glucose management is an issue. So I think I'll ask them to reduce. I wouldn't give them up to moderate amounts of roots and tubers, because in as much as they contain potassium, they also are a good source of carbohydrates as nutrients. Then for the grains, I would encourage patients to take 50% of whole grains. Grains also contains fiber, which would help to modulate the patient's appetite during the day. It will help reduce weight gain, which is detrimental to the management of diabetes. Also, I would discourage them from taking processed grains, which are usually very high in salt, very high in preservatives, added sugar. Then I would encourage patients to take legumes, nuts, as they are natural sources of fiber, also phytonutrients, vitamins, and minerals. I would encourage patients to take proteins, 0.8 grams per kilogram. In fact, I think that the major supply of energy for these patients, diabetic patients, should be from other sources and not necessarily high carbohydrate sources. So the protein should be at least the amount that I mentioned. Then I would encourage patients to take adequate amounts of fish, because they are rich in omega-3 fatty acids. They are also, they also help to boost immunity, which also plays a role in diabetes. I would discourage large intakes of meat, because of the contents of the fat content, which is usually very high. I would stop patients from, I would not stop because I can't do that, but I would ask them to stop sweeteners, which would worsen glucose metabolism or sugar control, because the thing is that most sweeteners contain simple carbohydrates, which are usually which are usually taken fast into the bloodstream, and they don't undergo. That's unlike the complex carbohydrates that will have to undergo the process of digestion, and the body will have to release ATP first of all before the energy that is required from the food is gotten. So the body has to expend some level of energy as against what people can get from sweeteners rather. Then for eggs, I would encourage the patient to take at most 3 eggs per week, and it has to be boiled and not fried. Then I would discourage the use of unnecessary condiments for making food, because they what's this compound again? I'll remember.
Okay.
Then beverages. I was just like.
Thank you. Thank you. So does anybody have comment on the things he has said?
Yeah,
I just want to talk about the fruits.
Okay.
I think fruits contain simple sugars.
Okay.
So I think maybe the patient should take low glycemic fruits.
Very good. Very good.
Yes.
Such as
such as berries.
or English
I know berries.
apple.
Cucumber.
English
Such
pear.
as cucumber.
Cucumber is
Cucumber
not.
is good,
It's
but
not.
it's a vegetable.
Cucumber is
Vegetable.
vegetable.
It's
Okay.
a vegetable, but it's also good.
Okay. So the comment on fruit now is, if everybody is taking 2 servings, Somebody who has diabetes can take 1 serving, and that 1 serving should be grape or apple or English pear, something that has low glycemic index. Don't tell a diabetic patient to take watermelon or pineapple. Okay, so that's that. What he said about vegetable, any comment? Vegetable should be at least 3 servings, not at most.
Yes, ma'am.
Okay, thank you. At
Yeah,
least.
I think he merged it together.
Yeah, so we sorted
saying
out.
2 servings of both fruits and vegetables.
So vegetables should be at least 3 servings, okay?
3.
Comments on roots and tubers? Any comments? Okay. He said they should limit roots and tubers, which is good, but it seems he would prefer that they limit roots and tubers and eat grains. That's the way it sounded. That may not be what he meant, but let's iron this out once and for all. Roots and tubers should be limited, fine, but they are not dangerous because they contain carbohydrates. Always remember that the carbohydrates in the roots and tubers go along with fiber. So the fiber makes the release to be slow. So they can take 3 servings. You can imagine a serving to be like a thin slice of yam. If they take 2 or 3 with a lot of vegetable, that's fine. So the point there is that grains are not better than roots and tubers. That's the point I want to emphasize. So many of our colleagues have practiced that idea of, oh, you have diabetes, don't take yam, don't take eba. But they will not tell them not to take bread. So I see that as misinformation. I'm not saying from Dr. Ikena's point, I'm just using the opportunity to emphasize that, okay? Any comments on what he said about sweeteners? Very good. He said they are not good, and I agree with that. So addition now, apart from the things he said that sweeteners will cause, they also cause rebound appetite. Just an addition, they cause rebound appetite. So the chemical sweeteners cause rebound appetite. That means though people run away from the natural sweeteners and say, oh, I don't want to take carbonated soft drinks without sugar, then they take diet Coke. The saccharin or other chemical sweetener in that diet drink will cause rebound appetite. So the person would want to eat more, and that process will release more carbohydrates into the system. Okay, any comment on egg?
Yes, ma'am. He said at least 3 eggs.
What's your comment?
I said
He
at
said
most.
at least.
I said
I
at
heard at
most.
least.
She said at most. He said it correctly, actually. But my comments is just an addition. For both hypertension, diabetes, hypercholesterolemia, obesity, and other conditions that travel together like that, the first thing before you make a recommendation about egg is to check the cholesterol level. If the cholesterol level is high, don't allow egg at all. That's the recommendation. If the person has hypercholesterolemia, then no egg at all. If the person's cholesterol is normal, then the person can eat white egg. I mean, if the person has hypercholesterolemia, the person can only eat white egg. But if the cholesterol level is normal, then the person can take 2 eggs in a week. 2 eggs in a week. Because if somebody has some of these conditions and for whatever reason, the cholesterol level is normal, well, maybe the person can take 2 eggs in a week. But don't always remember that all these non-communicable diseases, they travel together. So even if somebody doesn't have hypercholesterolemia today, likely to develop it at some point later. So you are careful. You cannot tell such a person to be free with egg, to be taking 3, which is the maximum in a week. Thank you very much, Dr. Who started? The first person. The first person that started.
So hello, ma'am. Excuse me, ma'am. I have a question?
No question here. Just write down your question in the chat too. So thank you, Dr.
Okay,
Ahmed and Dr. Ikena for discussing dietary approach to manage diabetes. Please write your question in the chat too. I'm conscious of your next lecture. Yeah. So there's fat. I think Dr. Ikena talked about fat. So when you're managing diabetes, fat is also important. Little oil, less meat, low fat milk, all the things you can explain about fat are important. They should avoid skipping meals. Very important. They should eat smaller meals 5 times a day, about 5 times in a day. So the idea is that you just eat small meals and release sugar into the system gradually, rather than a large meal that will require a lot of insulin. So skipping meals worsens resistance to insulin. It's also a good idea to eat around the same time every day, so the body knows what to expect. When people eat haphazardly, it causes stress to the body. Yeah. Then alcoholic beverages are not good. They worsen insulin resistance. So the next thing is hypercholesterolemia. And it's good to note that what causes this condition is not just high consumption of cholesterol. Saturated fat is usually converted to cholesterol. So that means saturated fat must be limited. Stress also increases the level of cholesterol because of adrenaline. So that means stress must be managed, avoided, or whatever. There are different methods of managing stress. The scope of this lecture does not allow us to teach stress, but you can pick up the book on stress and read it. There are different ways of managing stress. Can be avoid and alter, you can adapt, you can accept. Foods that are high in fiber are also very useful. Fruits and vegetables, usually those with pectin, useful. Exercise is very useful. Exercise can help one to reduce cholesterol. So when you are managing hypercholesterolemia, I guess it's a good idea to discuss some of the things we discuss under obesity and hypertension. As I mentioned, each food group. Gout used to be a big deal before, but it's no longer. Just for the purpose of completion, just know that gout can also be managed by diet. That was practice in those days, but now it's that problem with gout is resolved. Renal failure can also be managed with diet. The situation in the renal failure, the kidney cannot remove all the nitrogenous waste. So there's a need to reduce protein and yet maintain nitrogen. So what do? We restrict protein intake in such a way that the body still gets enough to survive, but less waste to cope with. So the way to achieve that is to make 70% of the protein to be from animal origin, to supply essential amino acids, and 30% from plant origin to limit the non-essential amino acids. So we know that protein from animal origin is higher quality and there will be less waste. So we increase that during that period of the management. But you see, the problem in this situation, one has to be very careful because too much protein of animal origin can still lead to further damage of the kidney. So that's why it has to be well regulated by dietitian. That's why I'm not placing a lot of emphasis on it in this course. But just know that there's something called native diet, and that involves 70% animal origin, 30% plant origin to supply the protein. The summary is that the amount of protein will just be about 21 grams a day. So if we have to supply it from plants, animal and plant origin, we can have maybe one egg, which will give about 7 grams, maybe crayfish, fish, and then you just have some beans and rice to give 30% from plant origin. So total will just be about 21 grams of protein. So somebody cracked the joke that most Africans are already on Joe Banetti diet anyway. So it's not a problem. Cancer is another problem, and this means abnormal proliferation of cells. 30% of cancers are caused by unhealthy diet. In that situation, there is weight loss, and this is where diet now comes in. Although there is weight loss, we cannot give them jumps so that they will now increase weight based on jumps. That will not make sense because the kind of foods that led to the cancer in the first instance cannot solve the problem. So even though there's weight loss and there's a desire to increase weight, it must be done with healthy foods. High calorie, high protein, but healthy. So in such situation, since fruits is healthy, vegetables is healthy, they can have as much vegetables as desired. Then a lot of fluid to maintain hydration, and eat roots and tubers to supply a lot of calories. Whole grains supply a lot of calories and other nutrients. And if natural supplements can be obtained, it's a good idea to give them natural supplements to increase their access to antioxidants. So if you have questions, this is a good time to ask. Okay, I can see a comment from Dr. Azaki. So that comment, thank you for the comment. Maybe that was before I talked about diabetes.
Yes, ma, that was before.
Okay, thank you. Small meals, small portions up to 4 to 5 times per day. Thank you. Skipping meals is not good. It worsens glycemic control. Any other question? Somebody said she wanted to ask a question earlier. Is she still in class or she has left?
Okay, ma, I wanted to ask, if for all of them, if we avoidance of alcohol, caffeinated beverages, will we be wrong for all of them?
You will not
I have a question.
Okay.
Go
Okay,
ahead,
thank
sir.
you, ma.
Okay, so concerning the of eggs per
You need to
per
speak
week.
louder so that we can all hear you. Dr. Ahmed, sir, speak louder, sir. Our Oga.
Um,
Dr. Ahmed, we are waiting for you.
Yes, ma'am. So I was actually asking concerning the egg. You said 3 to between at most 3 eggs in a week. We had the patient with intraperitoneous fistula some time back, and the surgeon came, and part of the dietary this for the patient was they said the patient should take up to about 10 eggs a day, cooked eggs a day. I don't know how to reconcile that.
10 eggs a day.
Yes, ma'am.
Managing what? We can't hear you. Maybe you write it.
Intraperitoneous fistula.
Okay, so that's a special condition. I don't know how long that will be, but to see, we are discussing lifestyle here. So many of our colleagues are not aware of some of these things. That's one point. Some of them are just aware of how useful something is for their own situation, for the management of that particular situation. So if they are aware of the other side effects, maybe they may want to modify it, but I don't know what would be the I don't know how to approach it at the moment. But for me, I think giving a patient 10 eggs a day is not necessary. There must be a way out of that condition. There must be alternatives. So we need to ask them, what do they want out of the egg? You know, egg is a complete food. It
Thank you, ma'am.
protein, fats, vitamins, minerals. So what exactly do they want to get out of the egg? What is it? You want to answer, please? Dr. Ikena, you have an idea of what they want from the egg?
No, not at all, ma. I wanted to ask a question.
Okay,
Maybe
so
I was actually
Dr. Ahmed, have you
I think
sorted
it's
out?
me, man.
Eh?
I'll be
possibly the hello, ma'am.
I can hear you.
I said maybe I'm just trying to maybe add the guess. Maybe possibly maybe in such patients they might actually have low albumin. Maybe they want to optimize the patient's albumin level.
Okay, no. Generally, patients with fistula they have protein loss from exposure of the partly because of the exposure that happens. But I thought you were trying to ask like what do they want to get from 10 eggs
Yes,
specifically?
that's
So,
the question.
I know that like what they are trying to do is to ensure that there is adequate um protein balance. But what they want to do with 10 eggs, I actually don't. I
So
have no
if
idea.
what they want is protein, then if it's the albumin, they can use the white egg. Yeah, because the albumin is concentrated in the white egg. Am I right?
Yes, ma'am.
So even if they want 20 eggs, the patient can be on the white part, not the part that is full of cholesterol. So that's I think we can conclude on that. Any other question?
Yes, ma'am.
Yes, ma'am. Yes, ma'am. Yes, ma'am. I have a question.
Please.
Hello. Okay, I know we talked about them, not we talked about meat, that animal meat, that fish is preferred because it has omega-3 and all that. Is there a role lean meat can play? LEAN, lean meat. Because I read somewhere that is actually good for the to take lean meat. So instead of, because I know that meat lovers, so
Okay, so
instead of
what
them
is
to
lean
say,
meat?
instead of me
Tell
to
us,
say
what do you understand by lean meat?
lean meat, they are the part that's meat that has this fat taken out.
Okay, so
So
you
when you
guys,
take out the fat of
when
the meat,
people write lean meat, some of them may even include fish when you say lean meat, yeah. And then in some other palace, it would just mean you remove the red part, the fatty parts of beef, and then they are calling it lean meat. Or even chicken, remove the back of the chicken, the visible part from the chicken, and then some parts of chicken are actually less in fat compared to others, and then you call them lean meat. Whatever you call them, whatever we refer to as lean meat, is definitely safer than the saturated, the fat that is full of the saturated fat. But let me not deceive you. Generally, meat should be limited. That's it. Because some people don't even understand what you mean by lean meat. And they may deceive themselves thinking that what I'm taking is lean meat. Some people believe that as soon as they remove the skin of chicken, that is lean meat. So for me, I would generally tell people reduce meat. Whatever meat, just reduce meat, because we may not know which one is lean meat or the one that is not lean meat. So that's my take on it. But it is true that lean meat is safer than saturated meat that is full of saturated fats. Yeah. Any other question?
Yeah.
Go ahead,
My
please.
question is about we mentioned skipping of meals and all of that, like it is not encouraged. So I want to know, I've also seen a lot of people talking about like the benefits of intermittent fasting. Please, what is the role? Is it healthy? And like, what is the difference between intermittent fasting and skipping of meals? Like,
Okay.
that's my question.
Okay. So when people are engaged in intermittent fasting, it's not a one-day matter. It's a planned system that people are using to reduce weight, to reduce their cholesterol, and all of that. So it's like a journey, it's like a program. You can decide that I take dinner by 6 p.m. I will not eat any other thing until 12 noon the following day. So that gives me 18 hours. So during that 18 hours, the body would make use of whatever fat has been stored and whatever is stored in the liver. Of course, we go first before the body can even reach out to store fat. So people can also say, oh, 18 hours is too short. They want to do maybe 24 hours, whatever. And then they keep doing it consistently like that. So the body kind of adjusts to it, I guess, and they're able to achieve their goal. But skipping means like erratic, eating an erratic form. You just say you're not eating breakfast now. And because you are still that breakfast, you now get to office hungry, You see, there's soft drinks and meat pie. You definitely go for it by 12 noon because you have skipped breakfast and you are hungry. It's not a planned program, it's just a poor eating habits. Some people will even eat breakfast, they will skip lunch for whatever reason. So that for now, at this moment, that's the difference I see between the two. The first one is a planned program that is intended to achieve something, to improve health, or to achieve something. And it will be done consistently for some days. So that where the body may now adjust to it. But for the skipping of meals, erratic, the body is not expecting it. And I've not done any research and I've not looked into this intermittent fasting enough to know if it also has effects on insulin resistance. I have not researched it. So we are giving you a challenge to look into intermittent fasting and effect on insulin. But I'll tell you sincerely that this is not in the mainstream orthodox nutrition plans. It's more of the healthy lifestyle advocates that are promoting intermittent fasting that I know of. But probably people are already doing research into it, so I'll look into it. But it's beyond the scope of the lecture, so let's just leave it as it is now. Are you satisfied? Any other question?
Yes, ma.
Okay, thank you.
I have about 3 questions, just
I
form
hope,
of
yeah, I hope you
clarifications.
focus on your lecture. It's not healthy lifestyle discussions and all those extraneous things, because
Yeah,
what
definitely.
I've discovered about you people, whether NSC or NP, is that you leave your lecture, you leave the focus of your lecture, and you are concerned about those things that we are talking on online. I pleading with you, focus on this lecture, especially with the based on the fact that the time frame is short. Yeah, thank you. Go ahead, sir.
Yeah, just some clarifications, ma. Yeah, because due to the network glitches, at intervals, I couldn't hear some of the things you were saying. So with regards to when you were asking about dietary management of hypertension, okay, it was mentioned about, you were talking about cereals that contain fibers. I didn't get that. What your explanation, because I lost you for a while. Then you talk about skim milk with respect to calcium. I didn't get that aspect as well. Then the third one is you mentioned a statement that's with regards to management of diabetes. You said if cholesterol level is very high, that we do not allow egg at all. Then at the same time, you said only give white egg. So I was a bit confused. Those are my questions.
I got steam milk and cholesterol. What did you say before steam milk?
The first one, you talk about cereals, about with respect to fibers. So I didn't get that, but I lost it for a while.
You didn't lose me, you lost the network.
The network. Sorry.
Okay, so cereals. What we call cereals is the same as grains. And WHO recommendation is that 50% of grains taken should be in form of whole grains that have the fiber and other nutrients intact. That's the recommendation. If you are telling clients or patients, you encourage them to eat whole grains, especially when they are home. What is practical is to eat whole grains at home. Plan not to eat refined grains at home at all. So that if you are out and you don't have a choice, you now eat refined grains, You can balance it and have 50% whole milk. That's the recommendation. Then skimmed milk. What makes it skimmed is that the fat has been removed and the rest has all the nutrients intact. Only fat has been removed. So the calcium is still there. But the point is that you cannot recommend to people to say you must take milk the same way you will say you must take fish. There's no compulsory statement about that. That's what I said. It's not like fish. I mean, it's not the same as fruits and vegetables. I say, oh, you must eat fruits every day. You must eat vegetables every day. If somebody doesn't have money to buy milk, the person can make alternatives, tiger nut milk or almond milk. Get calcium from vegetables, from rice and beans, from other sources. I'm just saying that when telling clients, we cannot legislate it the same way we tell people to eat fruits. That's my comment about that. It's good to take skimmed milk, but it's not compulsory. That's the word. So these people know that what is in the milk that we desire is that calcium. So if they can get it from other sources, no problem, but they should get calcium. Just to say that there are alternatives if they cannot get skim, because skim milk is expensive. So if it's not clear to people and you now say you must take skimmed milk and they cannot afford skimmed milk, then they may revert to whole milk. Since it's compulsory, since I must take milk, and I cannot get this skimmed milk now, what will I do? Let me buy whole milk. But the person that is taking whole milk and the person that is not taking any milk at all, who is better? Please answer.
Yeah, the person that is not taking milk at all is better.
Okay. As far as these diseases are concerned, so thank you for getting it.
Yes,
You have gotten it now. Somebody already has hypertension, already has hypercholesterolemia. It's better not to take any milk at all than to revert to whole milk because you cannot afford skimmed milk. So if cholesterol is high, no egg. That's the recommendation. But you see, when you are giving people recommendation, if you don't explain it, they may just practice nonsense, especially with this economic meltdown. So you say, your cholesterol is high, don't eat egg. The recommendation looks straightforward because it supposes or assumes that you understand that what is bad inside that egg is the egg yolk. What is not desirable for the person there is the egg yolk. So if you just tell the people don't eat egg and then they go and eat fried meats, would you have achieved your aim? No. But if you explain further, say, because egg is still cheaper than fish now. As the reality that we are facing now in Nigeria, egg is cheaper than fish. So if you explain further and say, your cholesterol is high, we don't want you to eat that inside egg, the yolk, because the amount of cholesterol there is about the amount you are allowed in a whole day. And you still get cholesterol from other sources. So don't eat the egg yolk, or you can eat the egg white. So you have explained it further, and that is easier to manage because the protein in that egg white is good quality protein. Good quality protein, and it's good. I mean, it's good for people to consume. It's just the cholesterol in the egg yolk that may be too much. I hope we are clear now.
Yeah, very clear, ma'am. Thank you, ma'am.
Thank you, Dr. Fale. Any other person, any other question? You know, this class is peculiar in that it brings a lot of things together to solve problems, not just to give you, what do you call it? Today is just a funny day. It's not just to give you theory or give you information, that's the word. It's for us to reason together. How, if somebody has this kind of challenge, what can we prescribe? And I'm sure you are smart enough to know that when people set questions, they are not expecting you to just give them principles. They want you to solve problems at this level. So we're concluding the lecture, and I'm encouraging you, please read your notes, pen down questions, so that when we have revision sometimes next week, or the upper week, you can bring the questions. We as physicians have many opportunities to assist our patients in preventing or reducing their nutritional risk, including diseases. Proper hydration, reduction in healthful drinks, wide variety of food, more than 5 servings of fruits and vegetables, whole grain items in the milk, reducing animal recipe and health food drugs. If we do all this, we tell them the specific and how to translate the information to practice. I believe we will really help them and can reduce the prevalence of non-communicable diseases in our environment. Thank you. Have a nice day.
Thank you, Ma.